Hi, good morning, guys. I've just got my facial aesthetic hat on today, and I'm also a practicing general dental practitioner. It is very important to keep good notes. Note keeping protects you from litigation. And the UK is probably one of the countries in the world where the levels of litigation in dentistry is the highest. And I think we're going to get into a situation where this might become true for facial aesthetics as well, if we follow the same trend as the United States. So note keeping is very important. And to be quite frank, I've always tried to do my notes as well as possible. And in the dental world, I've started using apps like Kiroko, which is invaluable nowadays in keeping notes. And because if you may or may not realize, if your notes might be very comprehensive, but if they're not appropriate for that specific case or that patient, if they contain parts that's been copied and pasted, that's not appropriate for that specific patient or case you did, then it might be deemed, that you didn't take due care and diligence in creating those notes, and they were simply just copied and pasted, and you just simply forgot to delete that irrelevant part of the note. So your notes need to be relevant. And if you stand up before a committee, General Dental Council or General Medical Council, and you can't prove that these notes were made specifically for that patient, then you haven't got a leg to stand on. The other problem is in our day and time is we're often very rushed. As clinical practitioners, we are in high demand. We're in high demand in dentistry, high demand in medical fields, as well as facial aesthetics. If you're a qualified dentist, qualified plastic surgeon, whatever, you need to see a lot of patients. There's a lot of demand, and you often don't have enough time to do the notes in between your patients. And that's becoming more and more problem for me in my facial aesthetics practice, where I'm seeing more and more clients, and it's difficult because it's normally on a Friday, and when I finish off, I want to kick back and relax. I don't want to have a long list of notes to finish. The second big aspect of this is, and we'll go through this, so key points is here that it's important to have proper documentation. So the importance is not only to protect yourself, it's protect your client. You make note of allergies, etc. And it's very important to make a note of the injection sites as well. Injection sites give you an idea of where that product was administered. If your client comes back after 4 months after receiving some botulinum toxin, a neuromodulator, and they're incredibly happy, and you didn't do proper notes, and you didn't record the injection sites or the amount of units or the product you use properly, then how are you going to replicate that fantastic result? You're going to lose the client if you don't do it, or if you did something that the client didn't like, or the patient didn't like. You need to know about it. And then the legal and ethical implications is obviously the other aspect of it. And just remember, this is very important. If you're a dentist, if you belong to the General Dental Council or to a doctor and you belong to the General Medical Council, if you have a case of misconduct, a facial aesthetic case of misconduct made against you, then it will be trialed in front of the General Medical Council or the General Dental Council. It won't be trialed in front, there's no council for facial aestheticians. And you can lose your license to practice dentistry or medicine because of that. So that's why because you are held accountable by your council, it's much easier in the UK, for customers to report you to a council as if you were just a beautician down the road that done a couple of hours course in how to administer a toxin, and she's got a GP referring or prescribing Botox to her. So just remember, you will be held accountable as a practitioner, as a specialist, as a professional. So this is why I made a little video on a Saturday morning and how important it is to really do this properly. Because we are in an industry where regulating this industry is going to become more and more prevalent. The UK are making noises about how they're going to regulate facial aesthetics, and this is going to be good for everybody. It's going to drive up the standard, but it will also mean we have to tick our boxes. We have to make sure that the patient has been properly consented. We have to make sure that notes were properly kept. So this is what I'm on a mission about at the moment. And this is probably why I'm delving a bit deeper into ways to do this easily. I want to take away any barriers for facial aestheticians out there not to do it. I don't want them to be tied to a CRM to do proper notes. It shouldn't be the case. I want them to have a piece of software that's standing on its own, where they can just use that to create their notes and then copy and paste it into the CRM. Because if you're anything like me, you work in a couple of different clinics. They've got a couple of different CRMs. They've got different management systems for the patients that manages their appointments, etc. And you don't want to necessarily have that in your own clinic, and you're reliant on these systems. So by doing this, I'm creating something that I can replicate wherever I go. If I'm on a tablet or on my office, or I've got a PC in front of me, I can replicate it anywhere I go. So I'll keep you posted on what's happening, but I want to keep this as simple as possible. I want it to create something where I can use AI, not to generate information that's not relevant, but to enhance what you are putting in and to make it look a bit nicer, a bit more well written, and save you time. That's the main thing. I want to create a product that you can stand up and be proud to present, but also save you lots of time. So have a lovely weekend. Thanks for watching this, and I'll speak to you later.